adopted. Definitely, they are suffering with the corona attack, and also the few people are now facing the death, few people are going for the complication, and few people are there in ventilator, and a few people where even the infection is also there, they are not at all showing any signs and symptoms. This is all because of the maintenance of health. That's why it is very important in our life to maintain this. It is a one great sutra which is given by our gurus and our acharyas. Rasashastra, Swasthya Rakshanam. Whenever we are healthy, we should always try our level best to maintain our health. And also, this is another one more sloka which I really impressed by the Rasashastra and our Acharya Nagarjuna. That is Siddhe Karishyami Nirdaridram Idam Jagat. That is, if I no, if I achieve success in the preparation of Rasaushadhis or any medicines, definitely there will not be any daridrata, that is poverty, and there will not be any gada, means disease in the world. See, in this present scenario, because of COVID, if medicine is there, if any stream of medicine, okay, any stream of faculty, whether it may be Ayurveda, homeopathy, Unani, or allopathy. If some small medicines are there to this particular coronavirus, if it is already found, when coronavirus was detected long back, 2-3 decades back only, if they would have found some medicine for this, the world would have not faced such a crisis. Actually, it may be a economical crisis, it may be a health-wise crisis. Okay, so much of crisis is there that would not be there. That's why this Siddhe Rase Karishami Nirdaridram Idam Jagat is such a wonderful this word, or the shloka, or the sentence which is given by our acharya to at least in upcoming days we should be ready to prepare, or we should have some bunch of medicines in our hand, so that whatever it may be a communicable disease, or it may be because this is because of doshas, or a geriatric, whatever it may be, we should prepare ourselves, get ourselves to overcome such panic situations. And another 2-3 slokas are there before I wanted to. These are very much. No, I am very really impressed by this sloka. That's why I am putting you in front. This Rasashastra, so many there is objection. Just now I was discussing with our Pawan sir about so many people are claiming as Rasashastra is not Rasashadis are toxic, then heavy metals are there. Why? See, it is told in our classics only. Rasashastra is not only for Dhatuvada, it is Dehavada Dwara Muktireva Parama Prayojana is there. See, Rasashastra is such a wonderful, wonderful subject where both entities are there told. The four aspects of life are told: Dharma, Artha, Kama, Moksha. Okay, we can in Rasashastra by using Rasaushadhis, by practicing the rules, whatever which are told in Rasashastra, by practicing the things which are told, Sadrutta and all, we can achieve moksha also. By practicing Rasaushadhis, we can achieve success in treatment also. By preparing Dhatuvada, we can become rich also. Okay, all Chaturveda Purusharthas are achieved. That's why Shastra is such a wonderful this one. Indian alchemy, or medical science. It is not only a medical science. It is there is a Adhyatma is also there, Moksha Sadhana is also there. So such it is a complete system which is given by our ancient acharyas. We should understand it properly. That's it. And also Alpamatropogatva Tarichai Raprasangataha Supramarogyadaidva Aushadabdo Adikorasaha. This is one of the great sloka, great verse which is given here. I was just discussing with our Sir Pawan sir also earlier. In Corona, I have given small tablets, very small. My friend was telling, hey, such a small tablets are there, Vikram. How can it cure? I have taken big size tablets of 650 mg Dolo, and all very big tablets were there. It is very small tablet. How come it is going to cure? Shall I take 2 tablets? Shall I take 3 tablets per time? I told no. Take only one tablet. I have given a Rasaushadhis like Tribhuvana Kirti Rasa, Ananda Bhairava Rasa, and Loka Chintamani Rasa. Those three are very small. Okay, he was getting 2-3 days back. He was getting fever, and it was reading around 101, 102 degree. Immediately, by taking within few hours only, that has come to 97 degree normal. Whole night there was not shoot up in the temperature. Such a alpa matra. This is what live example, small example. That's why Alpamatra Upayogit, Aruchi, this one, the taste will not affect, Aprasanga, the vomiting will not be there, and even immediately, whatever the results we want, that will be achieved. That's why this sloka is very, very important. And also, Yogadapi Visham Tikshnam Uttamam Bhaisajam Bhavet, Bhaisajyapi Duryuktam Tikshnam Sampadate Visham. This is also very important sloka, where toxins are there in the medicines. If you use toxins as a medicine, if we purify them, we make toxins, toxic drugs, when we make them pure and when we convert into medicine form, definitely it will act as a very good medicine. There are rasayanas in small doses. That's why this sloka is also good. And also lastly, सर्वौषधि विशारदः भिषक् सर्वामयान् हन्ति सर्वभेषजं तज्ञत्वा राज्ञा प्रणर्पते भिषक्. That is, if any doctor, any stream of MD, if why can't we do any MD, if our doctor does, definitely they should know about the different methods of preparation of medicine. Especially this is useful for Ayurvedic peoples, where he may be a Shalya, he may be Shalakya, he may be Kaya Chikitsa, he may be anything, but the thing is, they should doctor. They may be any stream of MD, but they should know what is medicine, how to prepare it, how exactly this medicine is prepared, how exactly it works, where it is to be given, where and how it should be given, what is the dose, what is the route of administration, everything. If he knows, definitely the person will be able to cure the disease, and also he will be honored by even the kings also. Such a wonderful sloka is told in Charaka Vimanasthana. Thank you so much, my dear friends, for listening to these particular words. Next, let me go to the real presentation, the success story of ischemic gangrene. Okay, due to diabetes mellitus. Friends, in 2016, I got a challenge in my clinical practice, where all of a sudden one of the patients attender, who was really known to me since many years, and who was really believing in my treatment, he called me in the midday around 11:30. He called me, sir, I wanted to talk to you. Are you free? Yeah, I told, yeah, I am free. Just you can talk to me. What is the anything serious? Anything important to talk? Yeah. He told, yes, sir. One of my aunt is not feeling well. She's admitted in one of the famous hospital in Bangalore, that is Kim's Hospital. I will give you the details in the next slides. And he told, and then I asked, what happened? What happened? Then he told, sir, actually, doctor is she was having diabetes since 4 5 years, and she was on treatment. And last couple of months back, she got a tuberculosis, where she was also taking the tuberculosis treatment. Now doctor is telling us to go for the amputation. And then I told, why amputation? What is the necessity of amputation? No, sir, they are telling that there is because this layman, they will not understand what is artery, what is narrow, what is veins and all. They will not understand. That's why he told me, sir, some blockage is there, some blood circulation is not there. Something doctors were telling, and they told that immediately within 3 4 hours, if it is not going to ampute, then definitely patient will die. Okay, then I also surprised whether it is true or false. Why sometimes doctors also misguide. Sometimes people will also getting misguided by this different. Panicity will be increasing. So something will be there. That you all practitioners will be knowing about this. So then I told, no, no, how come it is possible? Then you send me the details by WhatsApp. Let me see whether surgery is really needed or not. After few minutes, I got a CT angio report and Doppler CD report of that particular lady, and it was very serious actually. That I'm going to present you in upcoming. This is what the introduction, and then I told, this is let detail about this particular case. See, in 29 to 2016, a patient by name Sundaramma, changed name, 62 years, female, visited to our hospital, Sri Sri Ayurveda Hospital, and with the complaints. And then they brought that lady to my OPD, and the complaint of that particular lady was pain and burning sensation in right hand, forearm, discoloration of fingers with ulcers, discoloration over right thumb, necrosis with the post discharge, and stiffness associated with difficulty in movement of right arm, shoulder joint, elbow joint, palm and fingers. These were the complaints. When I see in the patient, see this is the patient where you can see the discoloration here, darkness of the totally the right thumb, and the right hand you can see it was a little bit black and there was no sensation, and also this hand was cold, and see the you can see the close photograph of this particular hand. See, this was the thumb was totally black. It was just like a charcoal. Okay, totally the hand and palms were discoloration was there. You can see the different angles. See, you can see the clear demarcation here. Okay, demarcation, and also there was a pus formation, and it was foul smell was there. You can see the different in different angle. I am showing you. See, it is a near vision. You can see the charcoal like appearance of this thumb. You can see. And also, there was a ulcer in the elbow joints of the same right elbow joint, and also you can see the skin. It was turning into black color actually, and it was cold to touch and no sensation, and that lady was getting pain from shoulder joint to the fingers. Okay, see, this is the different. Okay, and history of the patient. Patient was a known case of diabetes mellitus and on medication. She was suffering with diabetes mellitus since 6 years, and she was and last 3 months before she approached here, she was diagnosed for the tuberculosis, and she was taking ATT tablets. Hmm? And on 25 to 2016, that patient, the lady, admitted in Kempegoda Institute of Medical Science, which is a very multi-specialty hospital and a very famous hospital in Bangalore. And condition there, after consulting so many doctors, it was diagnosed as a upper limb ischemia and was advised for right upper limb amputation. When they have seen the Doppler study and they have seen the CT angio of the right upper limb, they clearly diagnosed it as a right upper limb ischemia. And as per SOP and the treatment protocol, medicine will not work actually in such a condition. Then, of course, the ultimate choice of the treatment was amputation only, and they explained everything to the patient. This is the condition. This is the condition. We should go for the amputation. And the patient was really panicked by looking into. See, already 25th they have admitted, and 4 days after they have taken 4 days to diagnose the disease, and on 29th morning or 28th evening, they told I should go for amputation. Okay. Then patient was really panicked, and they called me. And this is the discharge case sheet. Discharge against medical advice. Discharge on request. It is written here. You can see here. And the patient. You can see right upper limb ischemia is it's a diagnosis. Okay. Here, advice and discharge. Patient was advised. See, you can see here, advice and discharge. You see, patient was advised about immediate requirement of surgery and the complications associated with the condition if further management is not done. It is explained to the patient. Okay. It was explained to the patient. She may go with the septicemia. She may go for the upper limb, amputation. Even after delayed amputation, if it's done, then she is definitely not going to survive. Everything was explained to the patient on the day of discharge. Even then, also, patient attender didn't accepted the words of that particular doctor. And 25th to 2016, she was discharged from the KIMS Hospital Research Center, Bangalore. Okay, then patient came to me as per the discussion over the phone, and they came to me, and I was there in OPD, and then I have seen the patient. I really, this is a very new case for me and very challenging for me. I surprised, and initially I was also not able to come to the conclusion whether to take this patient, whether I can cure it, because I didn't see such a complicated system. We used to see some small arterial blocks and some deep vein thrombosis and all, but that was not life threatening. But it is a life threatening case actually. What to do and all, I was a bit worried. And then what to do? But patients were not willing to go anywhere, and they were patient attenders were telling me, even patient dies also, don't worry, sir. Please continue your treatment. We don't want to go anywhere. But but I was not having that much of confidence. But by that particular time, then again, what to do? Patient has come. Patient were also poor. Also, they don't have that much money to go for the immediate surgery and all. Then I approached our Shalyatantra department, where my close friends were there in the Shalyatantra. They also told about the amputation. Sir, it is a case of amputation. Better you go for the amputation. Don't take the risk, because if you take the risk, if septicemia is more, then definitely patient is going to die. Then again, I was a bit worried. Then again, patient, I told the patient, no, no, people are so many experts are there. They are telling to go for the amputation. Then I cannot help you. But one thing I can help you. Let us see in Jaydeva Institute of Cardiovascular Sciences, one of the famous cardiology center, which is working for the artery related opinion from there. So I science and research March 2016. They also, they went and they consulted vascular. Also, it was diagnosed already 4 5 days over, no, after this complete occlusion of the arteries, and they opined that patient may benefit with right upper limb. See, I have sent that patient on 2 3. Okay, this patient came to me on 2 3 16, and immediately I sent that patient. Ischemia with delayed presentation, and I opined that patient may benefit with upper limb amputation. There also the opinion was same, which was there in the KIMS, for the amputation only. But in view of active tuberculosis, because tuberculosis was there, I can show you the lungs X-ray which was taken during the tuberculosis for this particular patient. But again, I was thinking that Jaydeva is a modality as well. Still, they told that no, in Jaydeva it is only cardiovascular. She may need some other support also, like a pulmonologist, neurologist, and all. So it is better to go for some other multi-specialty hospital. See, this is the 2 3 16, where it was in Jaydeva Institute of Cardiovascular Science and Research. Dr. Karthik has seen it, and he told that upper limb ischemia with delayed presentation with acute TB, tuberculosis. He has diagnosed here, and he again this advice: patient may benefit with right upper limb amputation, but a high risk of limb loss will be there. Okay, in view of active tuberculosis, refer to multi-specialty hospital. This is the opinion given by Jaydeva Institute on 2 3 2016, sir. And then so again patient came back to me, no, we don't want to go for the amputation. Whatever happens, let it happen yearly, here only with you. We will admit our patient in our Sri hospital. Then finally what to do? There was no choice for me. Then I told, no, if you want to admit the patient under me, you should give high risk consent and you should tell whatever is going to happen, it is your risk only. I don't want to take the risk, but 100% struggle what I should do from my side. 100% best out of best medicine what I should put from my side, that I will take care. But I don't give you the assurance, because this is already time is over actually. Then patient accepted. They have given me the written consent, and also 3 4 5 attenders from the patient side also came to me. They told, nothing, don't worry, sir. We have very great faith on Ayurvedic medicines, and also you, and in this particular institution also we have great faith. Some magic will happen. You just go ahead, sir, like that they told. Then I got some confidence. in myself, and then I started my research work actually. Diagnostic methods what I used is physical examinations. When I did the physical examination, there was revealed the absence of pulse. There was no pulse at the radial artery and brachial artery. And by seeing the discoloration of the limb with the necrosis of the thumb, it is felt that there is a problem with circulation. Okay, just by external physical examination. And then anyhow, laboratory investigations were there with that particular lady. They brought us so much of big file, routine blood investigations and blood biochemistry. Everything was assessed there for tuberculosis, for diabetes, some other blood parameters. That is routine actually. Then imaging techniques actually it was done in Kim's hospital only because she came with already a diagnosis. Okay, and then there was no room for me to go for further diagnosis actually. Here, imaging technology in CT angio of the right upper limb was done to know the level of arterial plaque. Actually, they did it. I didn't done it. They did it in Kim's hospital. Report says that focal luminal narrowness of about 80% noted in the distal part of right subclavian artery. You just see here, right subclavian artery, distal part of right axillary artery, brachial, ulnar, radial, arteries are not at all visualized. It was totally a block. I can show you the, I'll show you the, in further slides, I'll show you the CT angio photographs. And also, this is one of the diagnostic tool actually, CT angio. And another one is Doppler of upper limb was done to understand the arterial flow. Here also, Doppler study was telling that hypoechoic thrombus involving the right axillary, brachial, ulnar, and radial arteries with no flow. This is the color Doppler study was done actually. And also it says highly resistant monophasic flow in right subclavian artery. The subclavian artery, it was highly resistant. Sadananji, I am audible? Sadananji?
Yes, sir, you are audible.
Clearly.
Okay, sir, thank you. Highly resistant. Monophasic flow in right subclavian artery was there. Only a monophasic, no biphasic flow was there. Okay. So see, you can see this is the reference. I wanted to quote here. This is the Doppler study which is done in Kim's hospital. You can see is 26th February 2016. Yeah, the same what I read in the earlier slide. Hypoechoic thrombus involving a right axillary, brachial, ulnar, radial arteries with no flow actually. Highly resistant monophasic flow in the right subclavian artery. This was the Doppler study. And you can see the right CT angio report here. This is a Kim's hospital. You can see 27 to 2016. Focal luminal narrowness of 80%. I've shown in the earlier slide also. Noted in the distal part of the right subclavian artery, distal part of right axillary artery, brachial, ulnar, and radial arteries are not at all visualized here. Okay, see, sir. This you can appreciate here the flow of here. See, this is the brachial artery where this after this artery to the totally thrombus. It is totally blocked here. There is no flow at all. You can see only in the axillary artery some blood is there. From brachial artery, ulnar, radial, nothing, sir, nothing. You can appreciate here. And also this is one more. This is one actually. This is one X-ray, that is CT angio report, and this is another one, sir, photograph. You can appreciate clearly here in this. Okay, sir, there is no flow at all. Okay, if blood is there, circulation is there, before they take the CT photographs, they used to use an injection. Okay, one chemical they used to induce into the arteries where the opacity like this, you can see the the blood flow in that particular arteries. Wherever blood flows, till that you can get the imaging. Okay, imaging technique it is. Wherever blood is not flowing, this dye is not going, there it shows the opacity like this. Then if it is opaque, then we should conclude that there is no flow of blood. Okay, this is one technology. And I told earlier she was having a tuberculosis. You can see here the left lung totally, it was you cannot see the lung at all. Only right lung, partially right lung you can see. Left it is totally not seen. This is the seriousness or severity of the tuberculosis or extension of the tuberculosis. Okay, sir. And other blood biochemistry, which was done in Kim's Hospital. This is the report I just attached here. And homocysteine level, sometimes it becomes a problem for arterial occlusion. That was also done. It was in the within normal limits actually, homocysteine level. And diagnostic challenge, what I faced is in treatment also we should think. We should not give the treatment to the poor people, those who are really not believing into the doctors, and those who are not affordable to the purchase the medicine. Such things are there, no? The rogi, adyo rogi, bishakvashaha, gnapakaha, sattvanapi, everything is there, no? In that particular Ayurveda, it has given us the guidelines, which patient to be selected, which is not to be selected. In such they are the very challenging, and they are very. We should observe very keenly for qualities in the patient. Here also diagnostic challenges were there in front of me. Patient was from poor background. This is a complicated thing actually. In such a complication case, if I write some high level medicines or high priced medicines, then how can patient will take that particular medicine? That was a very big challenge for me. And also in initial stage, patient was hesitating to consult the doctor also, because of that hesitation only this disease has become more. It has grown up, and also tuberculosis has spread that much extent. So these are all the very challenges for me. So the disease condition was worse and has become the challenge for the diagnosis and also treatment. Diagnostic reasoning, why, what is the reason behind the diagnosis of this particular patient was before she come to me, it was clearly diagnosed as arterial occlusion by sophisticated technology, modern technologies like a Doppler, CT angio, where there was no room for me to go for further differential diagnosis or some other type of diagnosis or some dosha murchana, something what we diagnose in our Ayurvedic method. That was not, there was no room at all. Already it was totally well grown and complete cessation of the arteries, and it was a complete case actually. And prognostic characteristics, it was challenged because prognosis was very poor actually, as the earlier references given, and also it was told by so many experts in the field of medicine and allopathy, where the diagnosis and prognosis was very very poor. And it was already told the complications and also comorbid conditions like diabetes, tuberculosis and all, where they were telling that only medical management was not at all possible, only that surgical intervention was the choice of treatment. But even the surgery also, the general anesthesia was not preferred actually, because of the extension of tuberculosis where lungs were not functioning properly. If general anesthesia or even some short anesthesia or some local everything, if it is given also, there was such a risk factors were there, because of the diabetes, because of the arterial occlusion, because of the tuberculosis, and because of patient was totally emaciated. She was very lean, and she couldn't able to withstand pain or whatever the complications associated with the surgery. So patient, it was very I felt it is very complicated. And then by believing into our Gurudev, taking the blessing of Gurudev, and we, our seniors, our gurus, we started the treatment with the help of my PG students and my colleagues in my department. Where type of, what are the type of, here I come to the main thing, what are the treatment I have given to that particular patient. Here is the list of treatment I am going to attach here. The types of intervention, there was two methods of intervention were in front of me. One is a medical line of treatment, another is surgical intervention, where a surgical intervention was ruled out, and only medical intervention was the ultimate choice to go ahead actually. And in medical intervention, I started with Jirakadarista 20 ml TID, Vayarista 20 ml TID, Arogyavardhinivati 1 tablet TID, Nityananda Rasa 1 tablet TID, Amla Parimala 1 tablet before food, Mehantakavati, it is from Sri Sri product, 1 tablet TID, capsule Cruel, Virgo, it is from Virgo company, I tablet one capsule BD, And syrup, Cardorium plus 1 syrup is available in Karnataka. That is from Alkananda company. That is 10 ml TID. And this is the medical line of treatment. And also Sthanika Abhyanga for the right upper limb with Jatyadi Taila and Nadi Sweta was given. And anti-tubercular and anti-diabetic drugs which were there earlier she was taking from the allopathic stream, they were made to continue without any disturbing it. Okay. And next surgical intervention, right thumb was totally necrosed, as you have seen in the earlier photographs. The right thumb was totally necrosed, and there was nothing, it was totally become black and charcoal like. So and also there was clear demarcation was there, foul smell was there, perspiration was there. It itself got detached from the attachment from the joint actually. And later, after 2 3 days, every day I used to do the dressing 2 times. One fine day it was totally detached, and on the bedside only we have removed that the thumb actually. Thumb was removed. Instead of saying removed, it has come out just like that. Okay, it was dropped. And initially I was no, because this is a new case for me. I was planned to go for Jalokacharana. Jalokacharana, I told my PGs to go for Jalokacharana. They also did 2 3 days they did, but they didn't told me. Ayo, they didn't told because Jalokas were not sucking the blood and they were not attaching also. Then after 3 days, they came to me, sir, Jalokas are not catching. We tried so many days, so many times also, but they are not. They were not catching. We tried to prick it with a prick that limb with a needle, but then also blood was not there and Jalokas were not catching. Then I questioned patient why it is not catching. I told I don't know, we don't know. Then I told them because there is no circulation at all. How come Jalokas are going to catch? You could have told me in the first day only. Then I discontinued that Jaloka Charana because there was no blood at all in the initial days. So Jalokas were not catching that limb. So that plan of Jaloka Charana was dropped. Then patient gradually we have given this. We continued the same medicines, and every day 2 times dressing was done. The patient was monitored for the diabetes level and heart, BP, everything was monitored. And every day the hand was, we used to check it for whether any circulation is established or not, whether it is going to be there or not, whether it is going to become infected, septicemia is going to become more or not. Everything I used to monitor. Patient was admitted on 2/3 and 23rd. Every day follow. Every day 23. It was there till 23/4/16. Okay, more than a month. And every day follow-up was done for a general condition, diabetic level, and patient was continuously monitored for wound healing and thumb of the thumb and re-establishment of pulse, blood circulation, etc. So gradually, after removing this thumb, gradually patient started becoming, little bit comfortable. Her face, her hand, the color changes in the limb, upper limb, everything. It has gradually it started coming, coming to the normal. Then every day I used to go for checking the patient in the rounds and all. I used to check the pulse. Gradually something started because this wound was there. This was the indication for me because wound was there. I removed that particular thumb. Gradually, when I started doing the dressing, I used to have Jatya Ritaila and Gomutrarka for the dressing here. When I rubbed here by the cotton, some after 4 5 days, some drop of blood started oozing from here. Something was oozing. So at that time, I got confident. Oh, something is there. Some re-established may be there, or some collaterals may be there. Like that, I thought. There were n number of questions were there in my mind, but still, let us see what is going to happen. We started doing the dressing regularly, and day by day, within 7 to 8 days, what happened was blood started oozing. While we do the dressing, at that time, drop of blood started coming out. Then I felt really happy. Really happy means really happy. This was no, there was nothing, nothing can be compared to that particular happiness actually here. After say 8 days, 7 to 8 days, blood started coming and foul smell went off, and you can see the red granulations day by day granulations started increasing. Then oh, very great. Actually we started some, because of blessings of our Gurudev and gods, and because of her, I don't know what her previous punya she got, this started becoming red and granulation started. It has become, that matter has spread to whole hospital. Something is happening, something is happening. So many people came and seen the patient. Even a plastic surgeon who was visiting to our hospital, he also came and he spoke about the skin grafting. He told, no, no, we will do it free of cost. Don't go for this one continuous dressing. If it is not going to heal, then it may become the complication. So we will go for the grafting. Then I told, no, no, nothing, sir. We will see for another 10-15 days. After that, if it is not granulation is not coming, then definitely I will come back to you, sir. Like that, I requested that particular sir, and sir also told, no, okay, doctor, don't worry. I am there to help you at any moment of time. Then gradually we started, we continued our dressing for 2 times a day. You can see the good granulation here. See, after you can see here the granulations, how the wound is looking here, and dressing method of dressing we were doing actually. You can see the different stages of wound healing here. Initially it was like this, later gradually see, you can see the complete healing here, complete healing of the wound. Okay, you can see. See, this is after complete healing. The wound was healed totally, and even lady, how she was in the first slide, and now you can see her face, how she is now. Okay, and this is how. And after complete healing, it has taken. She was there in my in our hospital for more than a month, and later also around 15 days to 20 days, maximum 1 month. It has taken me, regularly she was coming every day for the dressing for 15 days. After 15 days, once in 2 days we used to do the dressing, and she could able to move her four fingers which were there. Thumb was removed, only four fingers were there. This was she started gradually moving it, and the whole the limb, this movement has regained. She was earlier in the initial stage, she was not able to bend the elbow joint. She cannot lift her shoulder joint. She cannot move her hand, and she was facing so much of burning sensation, okay, tingling sensation. And at the end, she was feeling her limb was not at all there, like that she was feeling, and so much of discomfort was there. Everything has come down within 2 months. Then everything was healed, but I was not sure that whether the totally re-established, the circulation is re-established or not. I was not sure actually. So at least but CT angio will cost heavy for that particular lady. So what I did is, at least we'll go for the Doppler study. Doppler study within 1,000 2,000 rupees we can go for the Doppler arterial Doppler study in a good this one. That will give you that will clear our doubts up to 90-95%. So I request the patient to go for once again post treatment Doppler study. See, this done in 5/5/2016. 5/5/2016, again upper limb Doppler study was there. Repeat, we have done after the treatment. Repeat right upper limb Doppler study was advised for the patient, and it was done on 5/5/2016. The report state that no hemodynamically significant stenosis in the right upper limb. There was no significant stenosis in the right upper arterial system. Other details regarding the phase of flow, etc., are mentioned in the image below. See, this is the Doppler. I did it in Trinity Diagnostic and Imaging in Bangalore Research Center. It is done on 5/5/2016. You can see here subclavian artery, triphasic is there, axillary artery biphasic is there, brachial artery biphasic is there, radial artery biphasic, ulnar artery biphasic. And impression of this particular study: no hemodynamically significant stenosis in the right upper limb arterial system. This is was the Doppler study, and our name is Sundaramma is here. Okay, you can see here 63 female, and every circulation, everything has re-established. Then I felt good, comfortable, and I felt really our Ayurveda and our associates really works to cure it. Okay, this is what the this one after the treatment, everything the circulation has re-established, and discussion on strength and limitation in my approach. The patient was poor and was strongly not willing to lose the hand, but she was willing to face the death by septicemia, and she was having a faith in Ayurvedic treatment. So, by considering the request of the patient and by taking high risk consent, patient was taken for the treatment. This strength and limitations, and where the limitation is, same thing may not happen with other patients also. Whatever happened with this patient, and same we cannot expect with same medicines to other patient also. This is a point of research here. This is a limitation. Discussion on relevant medical literature. Relevant medical science says that, and when I googled it before I started the treatment, after starting the treatment, every day I used to google it, whether there is something in Ayurveda, something in allopathy, something in homeopathy, or something, any of in any of the countries, any of the doctors, any of the system, whether they are they have suggested some medicines. Let me see, like that we used to google it. Relevant medical science says that, you can also google here. Medical science says that ischemic arterial occlusion is a common complication in diabetes. Yeah, of course, it's very common, especially in the lower limb. Also, especially in the lower limb, it is more common, and same can happen in smokers. Okay, smokers, aneurysm, thromboembolism, trauma, etc. Most commonly happens in the lower limb. In upper limb, if an arterial occlusion, it is a rare case actually. Upper limb, generally it will not happen, but it will happen, but the percentage of upper limb arterial occlusion is very, very low. Okay, rationale for conclusion about this particular treatment and particular patient is, patient was diagnosed as a ischemic arterial disease with earlier reports, which may be because of diabetic complication. In my view, it can be compared with Shrota Avarodha in Ayurvedic line of diagnosis, which may be because of Dushta Kapha and Ama, which are the main cause for Prameha. And Ama and Dushta Kapha will make a Jatra Agni by which Dhatva Agni takes place, by which there will be a blockage in Srotas, that is Srota Avarodha. Here also Rasavaha Raktava Sroto Avarodha is happened, which ended up with blockage in the arteries, which is the main cause for ischemic gangrene. The treatment modality was also done according to Rasava and Raktava Sroto Dushti Chikitsa, and got success. After doing these two type of Rasavaha and Raktava Soto Dushti Chikitsa, we got success. In such type of patients, by systemic approach through Ayurveda, by proper analysis and proper discussion with your seniors and colleagues and experts, if properly treatment line of treatment is planned, then one can get success in the treatment, and also can save that patient not only the limb, whatever may be the complication, you can save the patient. And the primary take home message from this particular case is, patient was advised for right upper limb amputation immediately, and also because of active TB and diabetes, it was explained about the high risk factors for various factors at various multi-specialty hospital. So such complicated cases can be handled by Ayurvedic method of management, by which one, by proper understanding Ayurveda, proper understanding the line of treatment in Ayurveda, one can prevent the amputation, and also achieve the re-establishment of arterial circulation, and also you can save the life as well as money, everything of the patients, and also one can one can prove the Ayurvedic medicines how really they are going to work. This is what I learned from this particular patient, and everything, all this credit goes to our Puja Gurudev for giving us an opportunity to serve in such a great internationally famous college. Thank you so much for all of you for your patient listening. If something is there, let me know the things, sir. Sir, thank you, sir.
Excellent. Excellent, doctor.
Thank you so much, sir.
Great, great, great. This was a nice, unique case.
Sir,
And
thank
I
you so
hope
much,
you will continue this treatment, definitely.
sir.
Dr. Sadanand,
Sir,
Yes, sir.
great, great. Really excellent presentation.
thank you so
And
much.
it is a real case history, so it
Sir.
will be inspirational and inspiring and motivational for the student and motivational for the doctors also.
Thank you so much, sir.
Excellent.
Thank you. Thank you, sir.
So now I request participant doctors and experts, if you have any queries, please interact with Dr. Vikram. Now interaction is open now, so you can interact directly with Dr. Vikram, sir.
Dr. Prashant,
Sir.
Dr. Prashant, Mishra ji,
हाँ भैया नमस्कार।
namaskar, namaskar. Is there any question, Dr. Prashant?
नहीं नहीं बहुत अच्छा प्रेजेंटेशन था, बहुत अच्छा वर्किंग है और बहुत ढेर सारी बधाइयाँ कि अच्छे काम हो रहे हैं और बहुत प्रशंसा है इनके काम से।
थैंक यू सर, थैंक यू। आपका आशीर्वाद रहना चाहिए हम पर।
नहीं बहुत 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 एक्सीलेंट वर्क, बहुत अच्छा है, जान के अच्छा लगा, देख करके भी अच्छा लगा कि काम ऐसा हो रहा है और बहुत शानदार है। बहुत बधाई के पात्र हैं आप विक्रम जी।
थैंक यू सो मच सर।
सर नमस्ते। सर नमस्ते।
नमस्ते सर।
Namaste.
Any other question?
Sir, I am from Andhra Pradesh, sir. Dr. Sai Kumar.
Yeah.
नमस्ते सर। नमस्ते।
Sir, very good presentation which you have given, sir. Very nice, and this is the first time we are seeing this type of presentation here. I am very thankful to seeing a presentation, sir. Sir, here my question is that there is no the cellulitis is there, sir. No cellulitis is of the part, sir, and that patient. Cellulitis is there.
When patient came, cellulitis was not there, sir, because circulation was not at all there. Whatever the cells were there, it was totally shrunken. You could have seen in that particular thing in my slides.
Video.